Concussions are a type of traumatic brain injury, TBI, that occur when the brain is jolted or shaken inside the skull, often due to a blow to the head or a violent shaking of the head and body. Here's a comprehensive overview of concussions, covering various aspects. Definition: a concussion is a brain injury that affects brain function, typically causing temporary symptoms such as headaches, confusion, and changes in mood or behavior. Mechanism: concussions occur when the brain moves rapidly back and forth within the skull, causing chemical changes in the brain and sometimes damaging brain cells. Sports injuries, common in contact sports like football, hockey, and boxing. Falls, particularly in young children and the elderly. Vehicle accidents, collisions can result in head injuries. Physical assaults, blows to the head during fights or accidents. Symptoms can vary widely and may include physical symptoms, headaches, dizziness, balance problems, nausea, vomiting, fatigue, sensitivity to light or noise. Cognitive symptoms, confusion, difficulty concentrating, memory problems, feeling foggy. Emotional symptoms, irritability, sadness, mood swings, anxiety. Sleep disturbances, difficulty falling asleep, sleeping more or less than usual. Clinical evaluation involves a healthcare provider assessing symptoms, medical history, and performing a neurological examination. Imaging tests such as CT scans or MRIs may be used to rule out more severe brain injuries, but are generally not required for diagnosing concussions. Standardized assessment tools like the SCAT-5 Sport Concussion Assessment Tool may also be utilized. Rest is crucial, both physical and cognitive, in the initial recovery period. A gradual, stepwise approach to returning to normal activities, including school and sports, is recommended. For symptom management, over-the-counter pain relievers may help with headaches, but it's important to avoid medications that can increase bleeding risk, like aspirin. Recovery time can vary. Many people recover within a few days to weeks. But some may experience prolonged symptoms known as post-concussion syndrome, which can last for months or even longer. Factors affecting recovery include age, previous concussions, severity of the injury, and individual health conditions. Sports safety is crucial. Use appropriate protective gear, follow safety rules, and ensure proper coaching. Education plays a significant role too. Awareness of concussion symptoms and risks can lead to quicker diagnosis and treatment. Policy changes are also essential. Implementing and enforcing rules in sports can minimize head injuries. Chronic traumatic encephalopathy, or CTE, is a progressive degenerative disease linked to repeated head injuries, often seen in athletes. Some studies suggest a potential link between concussions and an increased risk of neurodegenerative diseases, mood disorders, and cognitive impairment. Children and adolescents are more vulnerable to concussions due to their developing brains. Return-to-play protocols are particularly important. Some studies suggest that women may be more susceptible to concussions and may experience more severe symptoms. Return-to-play protocols have been established by organizations like the CDC, NFL, and various sports governing bodies to ensure a safe return to activity. Adjustments may also be needed in school settings to accommodate cognitive rest. Ongoing research is focused on understanding the mechanisms of concussion, improving diagnostic tools, developing better treatment protocols, and exploring long-term impacts. Concussions are serious injuries that require appropriate recognition, management, and prevention strategies. Education and awareness are key to reducing the incidence and impact of concussions, especially in young athletes and high-risk populations. If you suspect a concussion, it's essential to seek medical attention promptly.